Effective immediately, Ontario is declaring a state of emergency. We expect this to remain in place for at least 28 days. Everyone must stay home and only go out for essential trips to pick up groceries or go to medical appointments. All we're asking is for cooperation for the people. Please stay home.
You heard it there. Ontario Premier Doug Ford says stay home. That order and new restrictions on businesses and gatherings are set to come into effect, and they come right after new case projections were released showing the province's healthcare system is on the verge of being overwhelmed. For the latest on the new rules in Ontario and what projections are really showing us, I'm joined now by the CBC's Megan Fitzpatrick in Toronto. Hi, Megan. I know you've been following this all day. Help us understand. We're getting so many emails from people who are really confused about how this will be enforced, what exactly it means. Can you help us break it down?
Yeah, let's go through what this stay-at-home order means. First of all, it is to go into effect on Thursday, Vashi, at 12:01 a.m. And the government is saying really people should only be leaving their homes for essential purposes. They list a couple of examples in their news release of what those activities are. They include going to the grocery store, going to the drugstore, accessing health care, so a medical appointment, for example, exercise, or going to work if you are classified as an essential worker. They are also saying to employers, if you have an employee that can work from home, they should be working from home. They also made a key announcement on schools today, Vashi, as part of these new measures. Currently, as we know, schools in Southern Ontario are still closed, in class delayed until January 25th. But they said today in the hot spots, so Toronto, Peel, York, Hamilton, and Windsor-Essex, classes won't resume until February 10th. As for the rest of the province, the chief medical officer will advise the education minister by January 20th whether classes will resume as planned the following week. They've also added mandatory masks for younger students now in grades 1 to 3. Before they were recommended, now they're going to be mandatory. And they've imposed some limits on construction activity and some retail activity, Vashi. But I think there are still some unanswered questions as to what's allowed, what isn't, and how this will be enforced. Premier Ford did promise that enforcement would be stepped up of these measures and workplace inspections, but he also was urging, as you heard in that clip, for people to do their part and to follow the rules.
Yeah, I think you're absolutely right, though, to highlight questions around enforcement, for example, and some of the inconsistencies around businesses. Just to note, we did request Health Minister Christine Elliott to come on to ask her some of those questions. Her office declined our request. The backdrop of all of this, Megan, is, of course, the new projections put forth today about if things stay on this track or get worse, what it will look like in Ontario. And it was not a pretty picture.
No, it was not. I mean, they said we're already at a dangerous point, Vashi. And one of the key concerns is because cases continue to rise and quickly, that means more people are going into the hospital and more people are going into ICU. Already in Ontario right now, there are more than 1,700 people so sick with COVID-19 that they need to be in a hospital and so sick that they need to be in intensive care, more than 400 people taking up ICU beds. And the projections given today, one of the scenarios is that Ontario could reach 1,000 patients in ICU by early February. And that's just not sustainable because those are people in ICU just with COVID. Of course, there are a whole bunch of other people that need intensive care for other healthcare problems. And the officials were saying today that already, we know in some parts of the province, surgeries and procedures are being delayed, and they're projecting that that could get even worse. And when delay is, or when care is delayed, people die. That's what they said very bluntly. One of the other concerning projections, Vashi, had to do with deaths among long-term care residents. Ontario on a very worrisome track right now. They're projecting that the number of people who could die will be worse than the first wave, which was awful. Already this year, just in the last 2 weeks or so, well, since January 1st, 198 residents in long-term care have lost their lives and 2 staff members too, too. So they talked about just the spread of COVID-19 in long-term care homes. More than 40% of the homes in Ontario have an outbreak right now. And then the other key thing to take away from the modeling projections today, they were talking about that variant from the UK. They detected another 8 cases of that in Ontario. They reported on today, bringing the total to 14. And this is concerning because it's known to transmit more easily between people. And so they're saying if that starts to spread more widely in the community, we'll see even faster growth of the cases than we already are, which is bad. And that will mean more hospitalizations and more deaths. So certainly some very dire projections. And that is, as you mentioned, part of the reason why Doug Ford took these steps today. I think, again, there will be many questions as to whether they go far enough and some questions around the enforcement of these measures that were introduced today.
Okay, thanks for helping us break it all down, Megan, the CBC's Megan Fitzpatrick for us. Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.